morning, everyone. Namaste. A very warm welcome to all of you to the third day of IAFMCON 2022. I welcome all of you, and we have a long day today. Some very interesting topics lined up. So we all know what happens in the gut doesn't remain in the gut. But what exactly is happening what exactly happens in the gut, we all don't really know about it. So we have some very interesting speakers today to talk about it, talk about what's going on in the gut, whether it's IBS, SIBO, GERD, the different tests that can help in understanding more about the gut health. So our first speaker of the day is Dr. Priti Nanda Sibal. A very warm welcome, Dr. Priti. Dr. Short of words if I have to introduce you. So Dr. Priti is the president of IAFM. She's been an entrepreneur. She's still an entrepreneur. She's the CEO of Mediskool. When it comes to gut health and diabetes, she's one of the best experts in that area. So over to you, Dr. Priti, to tell us more about SIBO, gut health, and the interconnections.
Thank you, Dr. Ruhi, for this warm introduction, and thank you everybody for joining us early morning. We've had exceptionally good speakers in the last 2 days, and I'm myself looking forward to listening to the speakers today. So amazing wealth of knowledge, and I am hoping that I will also be adding something to that piece today. So I'm going to speak about irritable bowel syndrome and SIBO. How many of you have ever got irritated in your lives? Please raise your hands. Perfect. So when do you get irritated? Anybody in the chat box, if you can write, when do you get irritated? Whenever something does not happen your way, right? And that's the same what happens with our gut also. Our gut gets irritated when something doesn't happen his gut's way, when there is somebody there who is irritating the gut. And that is what we have come to know as irritable bowel syndrome. The irony of this situation is, that because we think that there is no cure for irritable bowel syndrome, whenever we go to the doctor saying, we have these gut symptoms, the doctor says you are stressed out, go home and relax yourself. And that's the reason I thought I should take this topic. Dr. Ruiz has already shared about me. I think 3 decades of being a doctor. I worked in almost every healthcare field, but I think the longest duration I worked in is in functional medicine. So I'm sure that there is something very sticky about functional medicine, and everybody here who's practicing functional medicine will agree with me on that. So I don't know whether you know or not, I'm an author of 3 books, and the 4th one is coming on emotional eating, cyclic keto, 4-hour rapid fat loss method, and what doctors must know about diabetes reversal. So this was me on the left side when I was a successful corporate businesswoman. Right? And then I was introduced to functional medicine. So I had these problems, and I was considered very, very successful in the business world. But this was my journey with my own self. And then when I got introduced to functional medicine, this is who I am now, right? And this is the power of functional medicine. And functional medicine, when I say the power, this is the power of internal healing. This is the power of showing self-love. This is the power of transforming or changing your lifestyle a little, step by step, and achieving what is actually real transformation. And this is the reason why I think functional medicine is sticky. And when we work from inside outside, we don't have to name diseases. I think this quote is coming to my mind and I must share that is, what is there in a name, a rose will always smell as sweet. And I think likewise, what is there in the name of a disease? You have to bring your body in balance internally. You have to look at the interconnectedness of the body, and if you connect it properly and put it in balance, all diseases will keep on sliding and health will keep on entering. Right? Anybody here who disagrees with me, feel free to share in the chat box, and I would love to have this debate. And when I say this, the most common disorder which I have seen in my practice now, which really irritates you when people say you are not sick. घर वाले भी बोलने लगते हैं कि पागल हो गई है या पागल हो गया है, right? They start taking you to a psychiatrist when it's only that your gut is getting irritated. It's a very, very common problem. 10 to 15% of the Western population suffers from this. Post-COVID, the documented incidents have increased to 21% plus. Data says that 1 out of every 4 people experience irritable bowel syndrome. And it is characterized by many symptoms, but I think the most troublesome are pain in the stomach, anxiety, depression, stool irregularities. And I will share with you some case reports very, very soon, just so that you can understand how troublesome this can get. Right? So whenever I have to tell people about irritable bowel syndrome, what I tell them is extramarital affairs, when it comes in open, the type of trouble that creates, irritable bowel syndrome creates that type of trouble. So keep this in mind, because by the time I reach the end of my presentation, you will know why I have said this, right? So, of course, we have some other symptoms of IBS more than 3 times per day if you're going for motion, diarrhea type. If less than 3 times per week, constipation type. Change in consistency of the bowels. You have to go multiple times. I know of people who are not able to reach their offices even by 2 p.m. I did not know that honestly. I never knew that life of irritable bowel syndrome patient can be so tough till I started working with them. Change in sensation, that urgency, that tenesmus, pain in the anal region, passage of mucus, bloating, all of these an irritable bowel syndrome patient can experience, only to hear from his or her doctor that you don't have any problem, this is all in your mind. Imagine what the patient goes through then. So few red flag symptoms before we start managing IBS, which we need to rule out are, if its onset is after 50 years, because generally IBS onset is at a young age. And if I look at my IBS program, I have patients from 15 years to 35 years, 40 years. That's the maximum who come to get relief for IBS. Fever, blood in stools, nocturnal defecation, unexplained weight loss, and laboratory abnormalities you must rule out for other conditions. Few other conditions which can present like this is irritable bowel disease, Crohn's, ulcerative colitis, lactose intolerance, celiac disease, diet-induced diarrhea, malignancy, and obstructions. And therefore, the red flag is very, very important, because we all know early detection is the key to better health. So what are the types of IBS we have? We have diarrhea type, we have constipation type, we have mixed type, and we have unclassified type. And I will go forward and tell you what these mean and what are it. But What I want to share here with you is, for an irritable bowel syndrome patient, what is it that we are curing? What is it that we are wanting to correct through functional medicine approach? And why is it that I'm extremely excited when I work with an IBS patient? Because remember, I have not met an IBS patient who's come to me with a history of less than 8 years. I recently met a 65-year-old, very fit guy from UK who has had IBS since he was 10 years. So this is the history. So what all we need to correct? We have to look at insulin resistance, fatty acid deficiency, additives in food, sleep, any medicines, nutrients, lack of nutrition, GMO foods, toxins, trauma, infections, chronic stress plays a huge role in IBS, inflammation, low stomach acid, dysbiosis, please keep it in your mind. We're going to talk about it a little more. Mineral imbalances, cellular dehydration, infections like mold, fungal infections, heavy metals. All of these can be irritating our gut. So if somebody thinks that the solution is like this, it's not. But if somebody thinks, is there a solution? A big yes. IBS has a complete solution. I have so many testimonials from patients telling me, Doc, you've changed our lives. We were scared of going out of our homes, and now we are traveling and enjoying our life and doing so much better. So all good things, they come at a cost. So IBS treatment also, we have to really go into detail. Now, one of the things which IBS patients all have in common is leaky gut syndrome. Yeah. So what is leaky gut? I think everybody knows intestinal permeability or leaky gut. And what happens is, whenever you have any of these things which are in the roots, it causes gaps in the lining in the gut lining. And because of that, toxins, bugs, gluten, casein, parasites, they all reach bloodstream and the autoimmune response triggers. And we all know irritable bowel syndrome is an autoimmune condition. And this is what happens. So from this healthy gut, we get to have an unhealthy gut because of those root causes. And the doctors today, or wherever you're going for treatment, they actually don't tell you this. They actually don't help you shift back from leaky gut to healthy gut and just send you back saying, you have some stress, relax, and you will be all right. And as I've already said, stress, toxins, pathogens, food particles which you are not able to digest or you are allergic to, drugs, infections, allergies, even cesarean birth, all of these can result into leaky gut. And this can further result into irritable bowel syndrome. Right? So let me share some examples of irritable bowel syndrome patients so that you understand what this patient is going through and you can relate, because almost more than half of the cases of IBS are not diagnosed. Right? So this 32-year-old male came to, I'm not disclosing the name for confidentiality. He was stressed. He had lots of anxiety. He was going through relationship issues because of that. He was constipated and sometimes diarrhea, headache, acidity, heartburn, pain in chest. He had been to emergency 3 times in the past 2 years. Because of acidity, he used to feel pain in chest and everybody said, go, because it could be a heart problem. And nothing used to come back, and he used to come back from the emergency much more stressed than when he had gone. Bloating, and he was not able to sleep properly. Then I tested for his parameters. I'm sharing some of them here. We found that his homocysteine was high, which indicates inflammation. We found vitamin B12, D3 were low. And we want to keep B12 at 650 to 700 and vitamin D from 50 to 60 always. We found that DRS, which is an indicator of a stress hormone, was extremely low. So we know that this boy, though only 32 years, was going through stress or had some stressful episode history in the past. Epstein-Barr virus infection. Old infection, but with very high titers. And in my experience, I've seen that whenever viral load is very, very high, of course, it clearly indicates that immune system needs a kick, needs support. But also I have seen that until and unless we work on the viral load through different tools, symptoms do not go away. Of course, there was an indication, clear indication that there was infection through the blood test. The monocyte, eosinophil, basophil count in total was 14, which should not be more than 7, 8. And this indicated infection. So we got NutriFit test done, and there was huge bacterial overgrowth and gut dysbiosis seen in this patient. In addition, this patient was deficient in B6 also, in glutathione, so the body was not able to detox, did not have the antioxidant potential. Malate was low, so amino acid deficiency was low. That's the reason hormones were not in proper form. Citrate was high, neurological functions were compromised. And that's the reason he had anxiety and depression much, much, much more than what generally IBS patients would have. 2-hipurate was high, which indicated high bacterial overgrowth, and Clostridia infection markers were also very, very, very high. So in totality, you can see how many of the factors and the root causes were present in this male of 32 years. I treated all of this, and within a period of 3 months, he came back to say that I have never felt this comfortable. I have no bloating, no anxiety. I've stopped my anxiety pills. I have proper motion once or twice a day, and I am feeling extremely healthy. Thank you. So, as you know, the power of functional medicine lies in precise targeting, pinpoint the root cause and taking it out. And I think this example was a clear-cut example, at least for me, that this is the way, and it can really help my patients of IBS. The second case, now she was a woman. She was gaining weight for the past 2 years, bloated abdomen almost always, frequent burps with black salt kind of taste, acid reflux. She was on Zipan DSR 40 milligram, Vybat. For dyslipidemia, she was on Rosavel. She was taking half of Charisma, 25 mg for BP, high pulse rate detected since 2017. Psychotherapy for anxiety in 2020, vitamin D, B12 injections twice in last 3 years, disturbed sleep pattern in 2021, which had improved a little. But imagine, and she was also a young girl, 15 days after joining, her feedback was, so generally you would see women are very, very, very precise in giving back information. So she was very regular. Every 2 weeks she used to write and tell me how she's feeling. Bloating is more than before, and I will talk about it why. After meals, it increases. Improvement in energy levels, agility has improved, movements have improved. She also had knee pains. Burps have decreased, feeling light and reflux after having betaine. 15 days of changing the diet. I had put her on an elimination diet. That's what I do for all irritable bowel syndrome patients. And if elimination diet does not work, then I recommend FODMAP diet only for 10 to 14 days, because patients on FODMAP diet, if they're there for long term, the gut diversity really gets impacted and it leads to more problems than effects. Sometime later, face looks slim, burping has reduced, abdominal bloating still there when I eat, lost 2 kgs, feeling good. Her IgE was high, 342. Her EBV IgG was positive. Vitamin B6 was on borderline. Arginine on borderline, which is a very, very important amino acid for gut lining. Gut permeability high. Dysbiosis risk, Clostridia infection was there. And she did a trek after 1 month of joining the program, I think 5 weeks. My feet, my knee, hip responses are fab now. Right knee pain has disappeared completely and burps are much, much lesser. I put her on a SIBO diet and burps very few and occasional, acid reflux none. Didn't have betaine for 5 days now, no antacid, no anti-anxiety, motions are good, bloating is much, much, much less than before. So this is what, we could achieve by just looking at the root causes. This is the third case and the last one, which I will want to show you here, because I have to cover another topic, which is small intestinal bowel overgrowth, and you will know why. So extreme gastritis, stomach bloating since morning till 1 p.m. Stomach gets extremely bloated, pain around the navel, 2 to 3 times every day, passes stool. Long blenches very often, taken Ayurvedic, homeopathy, allopathy treatment in the past, no relief. Taking homeopathy medicine for IBS, had complaints of severe gas acidity, GERD since 2008. I am suffering, but no cure. Did the same protocol, bilirubin, total bilirubin was high, homocysteine was more than 65. Gut dysbiosis were there, hepatic detoxification was impaired, so liver needed support. In addition to what I did for the last case, I advised this person 3 colon hydrotherapy, 5 drips of Mare's cocktail so that I could help him with his viral infections and setting his body in balance. 5 glutathione injections with advanced liver detox protocol. The test to rule out mercury. Got this done and he has no symptoms now. So what I want to say is IBS is no more a psychosomatic disease, friends. It is a disease of infections, food sensitivities, celiac disease, lactose intolerance, magnesium deficiency, low fiber. Studies have shown that, just increasing fiber for patients, a lot of patients can get benefited. Yes, some do not. Their symptoms aggravate only because they have severe small intestinal bowel overgrowth. Treat SIBO, then add fiber and see how IBS 2 months ho jata hai. So what I want to share here is that now, having said this, what is one most common thing I've seen after working with about 300 plus IBS patients in the last 5 months? I'm not counting with IBS patients which I've worked with before this. I've seen SIBO is the root cause. 70% plus IBS patients have SIBO. Dr. Mark Pimentel and Dr. Alison Sebecker have done a lot of work on this, and they are the ones who first found it. But now we know that this is the cause. As I said, extramarital affair, when it opens up, that's the type of problem it can have. Similarly, what happens is, because of various factors which we have discussed before, because of low acid in the stomach, which Dr. Goran will be taking just after the session, because of bad digestion of food, because of lack of gut enzymes, because of less motility, the bacteria which should be in the colon, large colon, they come to live in the small intestine. And that is why bacteria being in the wrong place creates all these symptoms of SIBO. You bloated, you have pain abdomen, you feel as if you're pregnant, right? You actually look 6 months pregnant after a meal, and then it takes few hours for you to settle down. But then what is the big deal if it's just a gas problem? Why does it trouble people so much? And what should we know so that we also know that this is different and we need to look into it? Gas trapped in the small intestine is very, very different from gas in the colon. gas in the colon has a much easier way out, right? It is very, very near to the end, but gas in the small intestine just gets stuck there. It's so long, so thin. There is no easy way of getting gas out. And that is the reason it keeps irritating the gut. And that is the reason it's a cause for irritable bowel syndrome. What does it do there? It stretches the smooth muscle wall, which causes pain. Inflammation of the small intestinal lining, which causes leaky gut. And another important factor, and that's the reason if you go back to the second case, whenever she had food, she had more bloating, because damage of brush border enzymes leads to carbohydrate intolerance. And that's the reason SIBO diet, we avoid carbohydrates completely for 2 weeks. And this leads to die-off symptoms in the beginning, but helps us get the patient out and all right very soon. So gas production in large intestine, friends, is normal, but in small intestine is not normal. And therefore, if it is happening in the small intestine, if you are having these symptoms, if your doctor has told you have irritable bowel syndrome, please don't think you have no hope. Be sure that it is a simple problem with a simple solution, which just needs some commitment from your side. So there's nothing to worry. Of course, we have 3 types of SIBO, depending on the type of gas which these bacteria release. Hydrogen release leads to diarrhea. Methane, constipation based. Hydrogen sulfide, you will have more diarrhea, less constipation. And these gases keep converting within each other. So I do a GI map, and I clearly can see whether there is methanobrevibacter smoothie, and I know if it is methane based, I need to go aggressive on my protocol to help the patient heal. So what can be the symptoms of SIBO? Much like IBS, bloating, pain, nausea. So a lot of patients come with me that we feel so much nausea, especially early morning, that's making us sick. Friends, it's SIBO. If somebody has told you IBS, cool, you can get rid of it. Burping, acid reflux, constipation or diarrhea, feeling fatigued, joint pain, brain fog, weight loss, food intolerances. You know, a lot of studies have now shown that starting from type 1 diabetes to rosacea, to acne, to rheumatoid arthritis, to lupus, SIBO is one of the common denominators, common behind all of these. So don't miss SIBO, and remember, whenever you will have SIBO, chances you will have SIBO. So very early years of my practice, about 5-6 years back, 7 years now I am into functional medicine. So 5-6 years back, suddenly when I was looking, working with gut patients, I realized that a lot of these patients came to me after taking 2 or 3 courses of Prepagard. And they typically came with a lot of fungal infection symptoms. They would have dandruff, they would have mucus, they would have either rectal itching, they would have cough. So they would have a lot of fatigue. Over the years of working with such patients, they have taught me, body has to be in balance always, right? Similarly, the gut has to be in balance. If you kill the bad bacteria, bad fungus which is there gets an opportunity to grow and grow. If you kill both, parasites get an opportunity to grow and grow. So you have to do a plan which actually would create balance. If it is screwed towards one side, हमारे कहते हैं बड़ी commonly कुएं से गिरे, कुएं से निकले और खाई में गिरे. Now, and that's what actually we all do with ourselves if we are self-treating ourselves, or we do with our patients if we are treating patients, if we do not balance the gut completely. And when I say balancing the gut, of course, the supplement protocol, the treatment protocol matters, but what also matters is the food we eat. Maintaining gut diversity is so very important, that when we are doing elimination diet with patients, one thing which happens is fiber gets further decreased. We must make sure that we've added fiber in a good way when we put patients on elimination diet. We must make sure that probiotics are added. We should not have prebiotics in the beginning, friends, because it would aggravate the symptoms. But adding good probiotics, very, very important. Adding probiotics which are good for fungal infections. We have now Candida Care available, which is beautiful results. Is very, very important when we want to keep our gut in health, right? Other benefits when we treat SIBO is anybody with weight loss. Ruhi, any indication on time?
Yes, we are done. We are it's 10.
Okay, just 2 minutes then. Reduced inflammation, increased energy, and die-off symptoms can be taken care of. You can use Epsom salt baths, essential oil massages there. But what I want to show you is structural defense. So motility decreases with SIBO and fruits lead to more bloating. Sorry for the lack of time and skipping these. But how can we treat SIBO? I have a three-pronged approach for it. Starve the bacteria by giving them the diet. Elimination diet with very low carbs, FODMAP diet for some time. Difficult cases, elemental diet works beautifully. Kill the bacteria with antimicrobials. You can use allopathy as well as herbs like berberine, oregano, and allicin. And for promoting motility, use meal spacing, right? And perfect, I've already said this. Use meal spacing. Ginger works very, very well. Iberogast is something which is present for many, many years when you get stuck. Chelated magnesium or magnesium citrate can really help you, and you can give it a dose till the patient has loose motions. Aloe vera leaf capsules can add to improving motility. And these are some of the tests where I did SIBO tests, and after putting them on the protocol which I've shared, they completely went well in a period of 4 to 6 weeks. So I had put 3 success stories. Maybe we can share it later with you. And all the symptoms, bowel movement was happening daily, abdominal pain was gone, brain fog was gone, facial rashes were gone. And therefore, you know, I think IBS is no more a disease which is in your brain. It is in your gut. And yes, gut and brain are beautifully connected. So my last line, which I want to tell everybody is, you will not be able to heal from IBS if you do not set your parasympathetic system right. But that's another talk, and I'm sure you will hear a bit in today's sessions about that. Balance your gut and brain axis and stay away from IBS. It is a completely treatable disease, and stay healthy. Thank you, Ruhi.
Thank you, Dr. Priti, for presenting this topic of IBS and SIBO so simply. I'm sure 30 minutes wasn't enough, and we will need another long session with you. Our audience will definitely need that. Thank you so much.
Thank you.